Well, over the past few weeks, health care has actually emerged as a political minefield for some Democratic presidential candidates. Massachusetts Senator Elizabeth Warren has dropped 14 points nationally since briefly leading the Real Clear Politics polling average at the beginning of October. Many are attributing the decline to her handling of Medicare for All. This week, California Senator Kamala Harris dropped out of the race. Harris was a co-sponsor of Medicare for All when she announced her bid in January. But over time, she walked back her position in favor of a Medicare expansion plan. But the political difficulties surrounding health care exist beyond the federal level. Last week, Politico looked at how Washington state's big run at health care reform informs the national debate. Joining me now is the author of the article, Seattle Times business reporter Paul Roberts. So, Paul, what would you say was the initial goal for Washington health care reformers? What did they end up with?
Well, initially they wanted to come up with a way to cover the gap in the state's Medicare expansion under Obamacare. So we had about 200,000 folks that were uninsured. We had skyrocketing premiums. We had really high deductibles. So for a lot of people, it was insurance in name only. And really the question was, how do you approach that as a state? And so whereas a lot of incoming lawmakers from the 2018 election wanted to do a Medicare for All, a version of that at the state level, legislative leaders realized that was politically too challenging. And so they wanted to do something more modest, the public option. And they initially thought they could save families anywhere from 25 to 30% on their premiums. And by the end of the process, it was substantially less, but they were still calling it progress.
Paul, you write in this article that despite Democratic control of both House legislative chambers and strong support from Democratic Governor John Inslee, the public option Washington ultimately settled for was far weaker than the authors had actually hoped for. What was weaker about it, and who wanted it to end up that way?
Well, so initially, the mechanism they wanted to use was going to be a cap on reimbursement rates, and they were going to say that insurers who worked under the public option would be able to reimburse doctors and hospitals only at the same rate that Medicare reimburses hospitals and doctors. And by that means, we were going to keep a cap on skyrocketing insurance costs. Unfortunately, doctors and hospitals weren't very excited about being reimbursed at that rate. They felt that Medicare doesn't reimburse high enough, and that typically hospitals and doctors make up for that by billing insurers at a higher rate for non-Medicare patients. This is kind of the secret that it's unspoken in the medical community, but that's really how they make their money. And so what lawmakers realized over time was that they weren't going to be able to pass the bill unless they raised the cap eventually to 160% of Medicare. Now, that's still better than nothing. They still were able to put a cap on premium increases, and they're hoping to save Washington residents anywhere from 5 to 10%. Not nearly as much as they were hoping for, but given that premiums were going up with double-digit increases every year, as much as 36% in 1 year, that's still an improvement.
When you step back and you sort of look big picture at this, what do you think the lessons are that healthcare reformers took away from this experience?
Well, first of all, you're going to need to sort of lay the groundwork with providers and hospitals because they're incredibly powerful politically. And, certainly in this case, we had hospitals and doctors going up to individual lawmakers and saying, we won't be able to make the economics work on this. And if we won't be able to, then no one's going to participate in the program and it'll never get off the ground. And what's useful there is that right now you'd have national lawmakers, Elizabeth Warren being one, who's talking about reimbursing at the Medicare rate. And there's a lot of folks in Washington state that will say that's just not going to work. It sounds great. It sounds like you're going to be making things much more affordable. But at the end of the day, doctors and hospitals won't participate. And already you can see Elizabeth Warren backing off a bit. Now, she backed off in part because I think Medicare for All is regarded as far too radical. And she recognizes that, and she's tacking back toward the center. But within that withdrawal on her part is this recognition that until you find a cap that providers and doctors and hospitals can live with, you're not going to get any substantial reform.
So what would you say, Paul, the lesson of this is incremental changes are better than sort of a big, massive, expansive overhaul?
That's really what state lawmakers have learned, both in Washington and other states. Colorado had the same sort of understanding or realization. It recognized that you're going to have your reimbursement rates be substantially higher than Medicare. And again, the lesson, as you say, is incrementalism. As attractive as it is to talk the big game, to talk about coming in and erasing the insurance industry and coming up with Medicare for all or single payer. I mean, that's a real attractive. It gets good coverage on the nightly news, but the nuts and bolts legislatively of making that work are much more complicated. And so the way that people are talking about public option in Washington state, they're talking about it as a modest first step. That is a sort of a bridge to something bigger in the future. You've already begun the discussions with providers. You've got, doctors and hospitals part of the conversation. You've got lawmakers beginning to get into the discussion so that maybe, 2 or 4 or 6 years from now, you might try something more substantial, but it's not going to happen overnight. And that's a lesson that lawmakers seem to have to learn each new session.
Paul Roberts with the Seattle Times. Grateful you can join us, Paul.
Thanks for having me, Rita.